My name is James Roth. I'm an OBGYN. I have been since 1993. Whenever you see an OBGYN, whether it's for a specific reason or an annual, if you're having irregular periods and you don't know why, and nor does the doctor, that is something that should be discussed. There are usually two reasons for irregular menstruation or menstrual cycles. One is hormonal. The most common one is polycystic ovary syndrome, which can get worse over time. The other one is mechanical, and in fairness, there's probably a third that incorporates both hormonal and mechanical. But the treatments are very different. For example, if a patient has polycystic ovary syndrome, that is not a surgical fix, it's a medical fix. If a patient has a polyp or a submucosal fibroid that's causing bleeding, that is typically a surgical fix. The other concern we have is postmenopausal bleeding, where women who are typically over 51 or 52 will have stopped bleeding altogether and all of a sudden start bleeding. In our OBGYN world, that is actually considered cancer until proven otherwise. And so we are very anxious when patients come in with a 3-year history of postmenopausal bleeding with absolutely no intervention or diagnostic workup. Having said that, most postmenopausal bleeding is not cancer, but the chance that it is very concerning. The majority of women who have postmenopausal bleeding is from an endometrial polyp, and that's easily discovered on hysteroscopy.